Hello all, and welcome to the Understanding High Blood Pressure and Sarcopenia Among Older Americans live event. We are so grateful that you joined us today to learn about these important topics. My name is Gage Dalton, and I am a public health analyst at the Department of Health and Human Services Office on Women's Health, and I will be serving as your moderator for today's event. Our vision at the Office on Women's Health is for all women and girls to achieve the best possible health, which is what brought us to the topics we will be discussing today. In observance of Older Americans Month and National Senior Health and Fitness Day, this live event aims to explore the relationship between high blood pressure and sarcopenia. Hypertension, or high blood pressure as I just called it, is a well-known issue, as according to data from the Centers for Disease Control and Prevention, nearly 1/2 of the United States population has hypertension, and it is one of the leading contributors to heart disease. However, in contrast to that, we know many of you may be wondering, what is sarcopenia? And to that, I will encourage you that our panelists will tell you all about it as we dive into their presentations. Today, you will hear from experts in women's health, physical activity, nutrition, and hear a personal testimony from a woman who has worked to reduce her risk of sarcopenia and improve her heart health. Audience members, you will have an opportunity to engage with the panelists through a live Q&A session once all of them have finished their presentations. And with that said, we will kick off the program with our first panelist. And we are excited to have Jenna Perkins join us today to discuss how menopause may increase the risk of developing both hypertension and sarcopenia. Jenna is a board-certified women's health and gender-related nurse practitioner, serving in Washington, D.C., Maryland, and Virginia. Originally from Detroit, Jenna completed her BSN and MSN in women's health at the University of Pennsylvania School of Nursing. And her career as a nurse practitioner launched in a busy downtown D.C. office, where she became an expert in urology, urogyn, sexual health, and pelvic floor disorders. Jenna is a member of several professional organizations, including the International Society for the Study of Women's Sexual Health, the International Society for the Study of Vulvovaginal Disease, the North American Menopause Society, the International Pelvic Pain Society, and the American Urogynecologic Society. Jenna, it is great to have you. I will turn the floor over to you.
Awesome. Thank you, Gage, for that very warm welcome. I am Jenna Perkins, and I like to say that I am making it my business to help women tame the most taboo subjects. So everything from Nurse Jenna, why do I pee my pants? To Nurse Jenna, why have I gained so much weight? To what happened to my muscles? And why do I have hypertension all of a sudden out of the blue? And so what is foundational to the work that I do is hormones. So before we start, I think it's important for us to get a basic kind of understanding of what hormones are. Hormones are simply just the way that your body delivers messages. So hormones tell your muscles to build and keep you strong. They tell your bones to work properly. They tell your eyes, your skin, every single part of your body has hormone receptors there. And so when we talk about menopause, it is about a decade-long transition and loss of hormones. And so with that, everything from your hair to your skin, to your nails, to your muscles, to your blood pressure changes because these hormones change. So estrogen in particular is a hormone that does a lot for the body. And so we'll start with what it does for the heart. Estrogen keeps the blood vessels that pump your blood all over your body. Estrogen allows it to be elastic. So if you think about like having a balloon and you try to blow a balloon fresh out of the packet, right? And you do that first breath and you're like, oh my God, why is it so hard to do? And then you have to stretch the balloon a little bit to give it a little bit of elasticity. We call that compliance. So the blood vessels around your heart, to your heart, from your heart, also need that same compliance. It needs that stretch. And so when we have estrogen loss, we lose that stretch. And so the blood vessels become stiff. And that is where we can have a situation where heart disease starts to set in place. And here's a big call out and reminder that heart disease is the #1 killer of women. And so if we are thinking about how we can live long, healthy, happy lives as women, we always have to be thinking about the heart. And so when it comes to high blood pressure, we can imagine if the estrogen is not around, we don't have that elasticity to our blood vessels, then it is very hard to blow up that balloon that we are talking about in this case. And so those blood vessels have more pressure because they are so stiff. And so that is the measurement that you are getting when you go to your doctor's office, is how much pressure these blood vessels are experiencing. And so again, high blood pressure is one of the indicators that you are at increased risk for heart disease. And so that 10-year menopause transition gives us a very long window of time where we can start to interrupt some of the changes that happen to the heart, and hopefully prevent or at least treat some of the hypertension that can happen in menopause. Next slide, please. Now, the other thing, or one of the other things that estrogen is in charge of, is how our muscles act. One of the things I love to teach people about is that your muscles actually need glucose or sugar in order to work properly. And so estrogen works kind of like a conductor to help insulin to get the blood glucose into the muscle cells to allow them to have the energy that it needs. And so when we don't have estrogen on board, we are at risk for insulin resistance. It means that our metabolism changes because functionally those muscles, they need the energy, they need the glucose. And when they don't have it, they're kind of starving. And so a process sets in place where your body is like, hey, I'm not getting the energy that I need. So everything that you eat, we're going to store all of that as fat, right? And so in the menopause transition, we start to develop these body changes, namely where you gain fat around the abdomen, right? So we call that the meno belly. And so with that, that also increases your risk of heart disease. And so if the muscles are not getting the energy that they need, then they cannot work properly and they can start to what we call atrophy, or get very weak and muscle loss occurs. And so when we're talking about sarcopenia, this is the process that we are talking about. And so hormone loss with the perimenopause and postmenopause transition directly affects your body's ability to maintain muscle mass. Even if you are not a woman, even if you are not perimenopausal or menopausal, if you are over the age of 30, we know that you are going to lose muscle mass. So we add insult to injury when we no longer have the hormones, specifically estrogen, that we are talking about today. So this perimenopause transition can greatly increase your risk of hypertension and also muscle loss, weight gain, and all of the other changes that put you at risk for the #1 killer of women, which is heart disease. So in conclusion, I would just like to say that hot flashes, night sweats, vaginal dryness, sexual dysfunction, all of these are things that women may think are bothersome in menopause, but they are also signaling that something deeper is going on. And so we should really pay attention because we have to be heart focused at all times when we think about women's health. And that is the conclusion of my talk today.
All right, thank you so much for that background on both sarcopenia and hypertension and how hormones play a role in both, Jenna. It was great hearing from you. So moving on to our next panelist, we have Dr. Roger A. Fielding joining us to talk about the role of exercise and physical activity in preventing and addressing sarcopenia. And Dr. Fielding serves as team lead and senior scientist of the Nutrition, Exercise Physiology, and Sarcopenia team at John Mayer USDA Human Nutrition Research Center on Aging at Tufts University. He is also a professor of nutrition at the Friedman School of Nutrition Science and Policy, professor of medicine at Tufts University School of Medicine, and the associate director of the Boston Claude D. Pepper Older Americans Independence Center. He is also a deputy editor of the Journals of Gerontology, Medical Services, and Calcified Tissues International and Musculoskeletal Research. Thank you for joining us today, Dr. Fielding. Please take it away.
Okay, great. Thank you very much, Gage. Really, thanks for the invitation to speak to you all today. And about a topic that I'm really very interested in. And I think just to sort of echo a little bit about what Jenna talked about, one of the fundamental changes that occurs in people, both men and women, as they age are these dramatic changes in body composition. We see this gradual loss of muscle mass, sarcopenia, which we're going to talk a lot about today. And usually accompanying that is an accumulation of body fat stores as well. And there are a lot of both metabolic and functional implications for those changes. But I think more importantly, the reason we are becoming more and more concerned about these age-related changes in muscle and fat and body composition is that as a society, both in the United States and worldwide, we are aging. So in a very short period of time, by the year 2030, 1 in 5 Americans will be over the age of 65. And what's also really interesting about that is that the fastest growing segment of the older population in the United States, both men and women, are individuals over the age of 85 years. So there are more older people now and will be more older people in the future than there ever have been in the history of mankind. This is also not just unique to the United States. This is a worldwide problem. It's occurring in more developed countries, but it's also occurring in lower and middle income countries. So we have a massive, what's called demographic transition in terms of age in our societies worldwide. So I think these issues about sarcopenia, heart disease, body composition changes are going to continue to be increasingly important because we are going to have many, many more older people that we're going to have to think about effective strategies to improve and maintain their health. So can I go to the next slide, please? Now, it's been known for centuries that people as they age lose muscle, but more recently we've been better able to quantify and measure these changes. And just to show you very briefly, this is a slide from what's called the Baltimore Longitudinal Study of Aging. It's a very large, ongoing clinical epidemiological study of people as they age. And in this study, at least in this analysis they did in this study, what they did is they plotted and looked at the age-related changes in muscle area or muscle size. These are the muscles of the lower extremity of your lower leg muscles, and they could measure this using some very sophisticated imaging techniques. And what you can see here is that from age 20 to about age 85, there's a gradual reduction in muscle size that you see here. And that occurs at about 0.5% to 1% per year. They also measured at the same time that they measured these muscles, took these muscle size measurements, they also looked at how much force or how strong these muscles could generate force and work. And you can see here in this gray line, the rate of loss in muscle strength in these same individuals over the same course of their lifetime from age 20 to 85 years of age. A couple of important points here. We lose muscle size or muscle mass at about 0.5% to 1% per year, as I already said. And then the loss in muscle strength that occurs is about twice as fast as that. So muscle performance or muscle force generation goes down, but about twice as fast. And more recently, we've really given a name to this phenomenon. If I have the next slide, I keep trying to change the slides myself. This is really sarcopenia, or the age-associated loss in muscle mass and function. And just to show you what this looks like, or what these images look like, the same is true in males and females. This is an example of a 43-year-old male. This is a CT scan through the mid-thigh. So this is an image, a cross-sectional image through the mid-thigh of this individual. The area occupied by blue is muscle. The area in green and in red is fat. The red is subcutaneous fat or fat under the skin. The green here is fat that's in between the muscle. And this is a 76-year-old male here. You can see the dramatic changes in muscle size, much less of the area occupied by blue, more fat infiltration under the skin and also between the muscles as well. And so right now we think about sarcopenia as being a syndrome that's characterized by the progressive, generalized loss of skeletal muscle mass and strength that has a risk associated with it of poor adverse outcomes such as development of physical disability, poor quality of life, and even mortality. We think now about the components of sarcopenia as being reduced muscle mass, reduced muscle strength, and some impact on some measure of physical performance, such as being able to walk down the hallway or get up out of a chair successfully or climb a rise of stairs. So let's go to the next slide. Despite a lot of the scientific progress that we've made about sarcopenia, it's really interesting. We were involved in a study that was just published last year that really asked physicians and clinicians in the community how familiar they were with the term sarcopenia. So basically, we asked these physicians, this was over 200 practitioners, 253, what their primary area of medical practice was, and how familiar they were with the term sarcopenia. And interestingly enough, you can see that the dark here is people who, physicians who are very familiar or somewhat familiar. Lighter is not familiar or they've never heard anything about it at all. In internal medicine or sort of general medical practice, there's high prevalence of familiarity, very familiar or somewhat familiar. Same was true in family medicine or geriatrics. But again, we have many, many clinicians here who are not very familiar or have never heard of sarcopenia at all. 15, 16%, 18% in internal medicine, 23% in family medicine, 13% have never heard of it at all. We do a little bit better in specialties like geriatric medicine. These are physicians that take care of older people, and in physical medicine and rehabilitation. But still, in some of those respondents, we had people that had very little familiarity or no familiarity with the term sarcopenia. So in addition to talking to you all about this, we really have to even increase the awareness of this syndrome and this condition among practitioners. We go to the next slide, please. Well, what can we do about sarcopenia? Right now, there is really good evidence that there are lifestyle interventions. We're going to hear a little bit about nutritional interventions from our next speaker, but it's very clear that individuals who are regularly physically active, doing regular aerobic and resistance strength training exercises can slow the rate of loss in muscle strength and muscle mass that occur with aging and essentially attenuate or help to prevent sarcopenia. And also in individuals that have already achieved significant loss in muscle mass and muscle strength, if they begin a regular program of exercise, either walking, aerobic exercise, coupled with some resistance or strength training exercises, or better yet, even doing both, we can improve both muscle mass and muscle strength in those individuals. And there are a number of studies from our lab and other laboratories now that have shown very effectively that that exercise training, even in very frail older men and women, can improve muscle mass, muscle strength, and physical functioning. The future in sarcopenia, I think, is also very interesting. There are a number of pharmaceutical companies and biotech companies that are also targeting muscle with medicines, with drugs, to try to improve muscle mass and muscle strength with pharmacologic approaches. And while we want to recommend always lifestyle interventions first, I think the future we may see the advent of some new and novel treatments for sarcopenia that might be useful either for people that develop sarcopenia due to hospitalization or acute illness or injury, or perhaps more severe cases where perhaps physical activity may not be the only thing we want to prescribe or recommend, but there may be important new medicines developed. We don't have those now, but I think the future will be a scenario where we'll see medicines that are developed for sarcopenia that can be used in conjunction with these important lifestyle interventions. So I think if I go to the next slide, but remember, right now, exercise and physical activity remains the only treatment for improving physical functioning and preventing disability in older adults and attenuating those changes that occur with sarcopenia as we all age. So thank you very much, and I'm hopeful we can have time for some questions a little bit later.
Yes, thank you, Dr. Fielding. And it was great hearing some of those steps, at least on the physical activity side, that we can take in addressing sarcopenia. And our next panelist we have is Maya Feller, who will talk about another way that you can address sarcopenia and hypertension together, being nutrition. Thank you for being here, Maya. Please go ahead.
Hi, Gage. Thanks so much. Dr. Fielding, I love that last slide because when I taught at NYU, there were things that I would tell my students, especially around aging and sarcopenia, and we would say often, if you don't move it, you will lose it. So that slide absolutely resonated with me. Yes, I'm Maya Feller, and I'm a registered dietitian nutritionist. Most of my work actually centers around metabolic health. And I work with people across the life cycle in thinking about diabetes, hypertension, cardiovascular disease, age-related muscle loss. And I want to take you through right now the role of protein in lean body mass. I always think it's good to give a little refresher of what protein, fats, carbohydrates actually are when we're thinking about them in the context of food. So you have your animal-based proteins and you have your plant proteins. When you're thinking about your animal proteins, it's going to be your meat, your seafood, your beef, and in the meat, you've got your poultry, then you've also got your red meat and your pork and so on. With your plant proteins, this is where we're going to see beans, nuts, and seeds. Those actually fall as well into that fiber category. So there's some overlap in your plant proteins with fiber. But now that we have an idea of our proteins as well as our fiber, I want to talk a little bit about the role of protein in lean body mass. When we're thinking about lean body mass, I want you all to know that it is significantly important when we're talking about maintaining blood sugar. And also when we're thinking about adiposity, that's your free fat mass, right? So lean body mass, really when we've got a higher proportion of it, actually reduces our blood sugar or makes it possible for us to have lower blood sugars, while fat tissue actually reduces that insulin secretion. And that in turn can have an unwanted effect where we tend to see people have higher amounts of circulating blood sugars and we see hyperglycemia come out. So when we see people that have lean body mass, a greater proportion of lean body mass, we actually think that they have a lower risk of developing type 2 diabetes than in a person with less lean body mass. Now, you might be thinking, what on earth does this have to do with the role of protein and fiber when we're thinking about sarcopenia? Just as we've heard before, as we age, there are significant body composition shifts. And so when we're thinking about protein and fiber, we know that dietary protein is really crucial, especially in our pattern of eating, because it's essential for maintaining some of the function of our cells, and it's also important for body composition. We want to make sure that we're taking in sufficient amounts of protein to support our lean body mass, and that we're also being very mindful that we're not taking in excessive amounts of added sugars or excessive amounts of synthetic and lab-made fats. The other thing when we're thinking about protein is the overall recommendations of what we should eat. I should say when I was in school, we were taught that it was 0.8 grams per kilogram of body weight was ideal for your protein intake. I would say these days we're thinking more along the lines of 1 to 1.2, 1.3 in some cases based on the individual. And we absolutely want you to vary that intake with a combination of animal proteins as well as plant-based proteins. Now, when we're thinking about the role of fiber in lean body mass, there's a great body of research looking at patterns of eating that have a high intake of dietary fiber. Usually we want people to have more than 25 grams of fiber per day, but there's some emerging gut health studies that are thinking that we should have somewhere around 50 grams per day, which is fairly significant when the average American is actually taking in around 15 grams of fiber per day. But what we do know is that when people have higher intakes of fiber, they tend to have more lean body mass and a lower fat mass. We also see a decreased prevalence in sarcopenia because there's this link. So we see more lean body mass, less free fat mass. And this is also the case when we see people who have modified their blood sugars and they have what we refer to as euglycemia. So let's move on to the next slide. Okay, so in the next slide, I kind of want to take us through quickly some solutions to think about these metabolic shifts that impact muscle. So it's really important when we're thinking about food that the foods are culturally relevant to us. Quite often we think about adding foods in, but they may not actually be appealing. And when we work with foods that are relevant culturally, we're more likely to actually want to engage in eating them. We want to make sure that there's variety in terms of your protein. I do like to see with patients that I'm working with, animal proteins in the pattern of eating, however, not the center and more as an accompaniment. And so I'm talking about your chicken, I'm talking about your turkey, I'm talking about your lean proteins, because remember, there's a component for cardiovascular health. So we want to make sure that it's also lean proteins, but high biological value. And I would love to see fiber-rich sources of protein in that pattern of eating. Overall, we like to think about the inclusion of whole and minimally processed foods. As we all age, body processes shift. And as we get older, some of the natural clearance that happens tends to slow down. We may become more sensitive to sodium-rich foods, and this, for some people, can actually put us at risk for higher blood pressure. So we really want to think about having whole foods in their minimally processed form. Yes, I know that once you take something from a farm, it has been processed. But when we say whole and minimally processed form, we mean the food itself does not have an abundance of added sugars, synthetic or lab-made fats, or added salts. Here's an example. You have an apple, and it's a cut-up apple, and you buy it from the grocery store in a bag. That is apple in its whole and minimally processed form. You have an apple, and it has been pureed, and sugar has been added to it. That is not an apple in its whole and minimally processed form. So what we really want to do is to begin to think about how we can curate plates that have an abundance of fiber-rich plant proteins, and that also have a nice amount, I'd say a fistful of an animal protein should you choose. And then we also want to see another fistful of, I like ancient grains, so teff, fonio, quinoa, some of those things. Also rice, there's black, brown, white, and red. Make your choice. And I'd like to see about a fistful there. I also understand when I go back and speak about culturally relevant foods that we don't all eat in compartments. So I want folks to think as they're putting together soups and stews and sandwiches and casseroles, how can they add those protein sources as well as sources of fiber in while being incredibly mindful of how they're interacting with the added sugars, the synthetic and lab-made fats, and the added salts. That's all for today, and I look forward to having questions toward the end of our presentation.
Thank you, Maya. I know for myself, having that example of fistful of grains and rice and those other helpful tips for our nutrition in addressing sarcopenia and hypertension is incredibly helpful. And then moving on, our final panelist today that we are thrilled to have join us is Ronni Ward, who will talk about her experience preventing sarcopenia in her own life through exercise and nutrition. Ronni is an active 67-year-old who owns her own consulting firm and serves as board chair of a local London County, Virginia nonprofit called London Cares. Her health journey has been a challenge over the years. She played soccer until she was 35 and started walking for exercise at age 55, trying different exercise and diet plans for the 20 years in the middle. And after some jarring realizations about her own health, Ronni began strength training 3 years ago and transformed her view on exercise and long-term health. And I'm sure Ronni can speak a lot more to that. Please go ahead.
Great. Thank you so much for including me in this panel of experts. I am certainly not an expert, and I absolutely love my new title of lived experience advocate, because I have lived the experience of being active, not being active, getting active again throughout my life. When they asked me to speak about my personal journey, I thought, like, how do you even describe that? But I think it's important to go back to my early years. I was born in 1957. And for any of you that are as old as I am, you know that in the 60s, 70s, when I was really growing up, they didn't have sports for girls. There were no Title IX provisions to make sure that girls had equal sports. So I didn't grow up around sports, but I grew up very active. I was on my bicycle constantly. It was my main form of transportation until I got my driver's license. And I would run around, and those were the days when your parents would send you out in the backyard and tell you to come home after dark, when it got dark. So it was an active outdoor lifestyle. College became this sedentary, you walked around a lot, but I wasn't actively involved in exercise. In my 20s and 30s, I got involved playing soccer, and I played soccer for probably about 16 years, and I didn't give it up until I started getting hurt. And I thought I better just kind of stop before I get seriously hurt. Got hurt because I was playing with, in my late 30s, was playing with 20-year-olds who had come up playing Title IX sports throughout their high school years, and they were real pros, and they were way tougher than I was. So I gave it up, and during my 40s, I was raising my family, and I'd try, every once in a while, a friend would convince me to go to a gym or join a gym or take a jazzercise class or take a step class. I remember once I did that. I took yoga classes, and I really disliked all of them. I found them to be so boring that they just didn't devise my interest at all. I had some health issues also in my late 40s. To go back a second, in my 30s and 40s, I also was traveling extensively for my job, and that's not a good lifestyle either. You're constantly in hotels, grabbing what you can on the go, grabbing what you can at an airport. I'd always pack my sneakers. I didn't always use the treadmill in the hotel. I really had to be motivated to do that. And so I was kind of pretty much sedentary through my 40s. I had some health scares in my 50s. I had a couple of bouts with cancer that set me back a little bit. And trying to get back in shape, I started walking locally with some girlfriends. And towards the end of my 50s, early 60s, I was probably walking 5 or 6 days a week, probably anywhere between 3 and 6 miles a day. And I thought I had it nailed. I thought I was in the best shape. I went to visit a new great niece that was born in North Carolina. I was 64. And when I went to pick up this sweet little 10-pound baby, I got nervous because I didn't feel steady. I felt like I was going to drop her. I didn't tell anyone. In fact, I was telling my child this today, and she was surprised that I had included this as part of my story. But that's what really set me on the search to find something to get back into shape, because I didn't even want to walk across the room with her. I was afraid I would fall. And so when I got home, I started looking for something to do. And I saw an ad for a new little local gym that was women-focused strength training, small group classes. So I called the trainer and I said, I want to hear what you do and how you do it. And she sat down with me over coffee. And the first thing I told her was that I hated exercise, that I walked extensively, and that I didn't know if this was going to stick, but I needed a jump start. Well, I started. We convinced her to do 7:00 a.m. classes, convinced a girlfriend to go with me, thinking there's strength in numbers. We started doing 7:00 classes 3 days a week. I didn't think I'd last 2 months. And here I am 3 years later. I'm probably not the strongest one of her group of people that exercises, but I have the highest attendance record at the gym. I've done over 300 and I think 30 sessions since 3 years ago. And I still walk, but certainly not as much because I'm out there strength training 3 days a week. And the results have been transformative. You can see from the pictures, the 2022 picture, you could see my weight was not great. And here in the 2024 picture, you can see me bench pressing some weight. I don't even know what it was. But if you go to the next slide, you could see there's data backing my results. It's not great data that all of the professionals here would use, but it's my own personal data. In 2021, when I started on my walks, I had started falling. Had really bad balance, and I was a fall risk, which is why when I held my little great niece, I was thinking, what if I fall when I'm holding her? I fell down a hill when we were hiking one day with my friends. I fell at a gas station. I was constantly scraping my knees and scraping my hands. Now, in the last 3 years, I've had one near fall, but because my balance is better, I was able to catch myself. And so I'm not a fall risk anymore, any more than anybody else who's in shape. Body awareness. When I started this journey, I would do silly things when I was lifting and just kind of bend over at the waist and grab something off the floor. And I had no awareness of how to use my body safely and effectively and efficiently. Now, I'm very aware of my body and how it works, how to pick things up. I even corrected one of my friends the other day who was picking something up all wrong. And I said, you shouldn't do that. You need to squat. You need to lift from the knees. And she just looked at me like I was some alien because stuff like that never would have come out of my mouth before. Overall strength, I started with a 5-second plank that I thought would kill me. I axe in the middle of the plank at like probably 3 seconds in, I thought, oh my God, I cannot do this anymore. Now I'm doing 60-second planks as if they're nothing. I'm doing side planks. I'm doing planks with toe taps. And so my overall strength has definitely improved. I started with those little tiny 3-pound weights, going like this. And now I'm doing much greater weights. My bone density, I had a bone density test in 2021 and I was at a good level, no degradation, but I just had another bone density test within the last few months and there were no changes at all, which if that's not telling, I don't know what is. My weight, I will talk about my age on a national panel, but I won't discuss the numbers of my weight, but just know that I was at the highest in my lifetime. And I'm down between 36 and 38 pounds, depending on the day. And I'm down sizes, which that was the amazing transformation, if nothing else, that I just went down to sizes I never thought I'd see again. And then my heart assessment was interesting occurrence. I had never had heart issues before. And on Christmas Day of 2023, I ended up in the ER thinking that I was having a heart attack because I had this intense pain on the left side of my chest. They ruled out a heart attack, and in ruling out everything that they possibly could have thought of from a heart perspective, they did every heart test known to man. So I had probably in the course of 2 months, probably 10 EKGs. I had a stress test. I had an echo test. I met with the cardiologist at least twice. And at the end of all of this, and they did obviously blood pressure checks every time. My blood pressure was great. At the end of it, the final results were, this was not a heart problem. Your heart's in fabulous shape. You have a benign murmur, so come back in 5 years. See ya. And that was it. So physically, I've transformed. More importantly, mentally, I've transformed, because I'm so much more aware of my health right now than I have been in the last probably 40 years. I'm so much more aware of my strength and where I need to build it. And I'm so much more aware of my stress levels and the fact that this weight training has really decreased my levels of stress. So my mental health has improved. And so I'm a success story in the world of sarcopenia prevention, because I've been doing all the things that everybody tells you to do, although not that good with the nutrition, but I try, and I eat pretty clean, but I indulge every once in a while. But other than that, here I am 3 years later, and I'm still going strong, and I'm still going to the gym 3 days a week. So there you have it.
Thank you, Ronni. Hearing about your journey toward both physical and mental health and the steps you took is incredibly empowering. I hope others can learn through your experiences as much as I just did. With that, we have reached the end of our panelist presentations, and we can transition into our Q&A session. Please feel free to add any questions you have for our panelists in the chat. And we did receive some already. The first of those is, how can you obtain a copy of this lecture? A recording of this event will be posted on the Office on Women's Health YouTube page once we finish putting it all together. And then question for Jenna. What does it look like to get screened for sarcopenia, and how long does it take?
So we actually don't do any formal screening for sarcopenia in my office. I think that might be a better question for Dr. Fielding, if that is something that other clinicians are doing. But essentially what I'm doing with my clients is we are looking at functionality, right? Can you pick up your 10-year-old great niece? Are you able to work out at the level that you want to work out? Do you feel confident in your strength and your ability to do your activities of daily living? And if there is any sort of concern, then I'm looking at interventions. And honestly, before there is concern, I am referring to small group workout sessions like Ronni has experienced. And so, yeah, I don't currently have like a formal screening for sarcopenia. I'm sure there is something developed in research that will be coming out, but it's not something that I do clinically at this point.
All right, thank you. Dr. Fielding, do you have any experience in screening for sarcopenia?
Sure. So what Jenna has said is actually true. There are really no accepted, sort of approved, sort of diagnostic tests, the way we think of them, to assess people who have sarcopenia. There are several national and international groups of experts that have made recommendations about tests that could be used to assess sarcopenia status. But I think right now we're sort of relying on what Jenna said. If people are having difficulty with their mobility, difficulty walking, difficulty with balance, perhaps even difficulty getting up on the exam table, those are things that may prompt someone to start thinking about sarcopenia. I think in the future, we might think about measuring carefully how strong someone's hand grip strength is as a very good measure of their overall whole body muscle strength, with a very simple dynamometer device, but that's not currently done. Then also maybe just assessing their usual walking speed or gait speed is another test that we know is a very strong predictor of sort of bad outcomes, falls, fractures, mortality, mobility disability. And then finally, new and cool, imaging techniques and diagnostic tests to actually directly measure whole body muscle mass, which, for research purposes, we have those things, but they're not really widely available clinically. But I think those are all for the future.
Thank you. And then moving on, for Maya, one of the questions that they had in the chat was, what foods are best for building muscle in older adults?
So in general, I like to think about where the person's current health is before I even say this is going to be the magic food that's for you. If you're dealing with hypertension and you're thinking about, okay, navigating your blood pressure, I'm always going to focus on, I'd say, a moderate protein intake with a higher fiber intake. If you're thinking about your blood sugars, I'm always going to think about how can we create a food pairing where you're not giving an extreme dump of sugar into your bloodstream. And that could be something fiber rich first in the plant family. It could also be an animal protein paired with a fruit or a vegetable. But I'm definitely going to think about proteins with little to no additives, for sure, seasonings. So herbs, spices that have a lot of, wonderful bioactive nutrients in there. And are just kind of delicious, but also great in terms of whole body health. So I'm going to think about seasonings in those ways, but I'm not going to think about adding salt. And so the other thing that I would say that especially for older adults, is we might want to, depending on how old the person is and what else is going on health-wise, we might want to think about how the proteins are being delivered, right? So what's the package? Is it in a soup, a stew, a sauce? Are we modifying the consistency? But again, I really want to step back and look at where's the individual's health and how do I make sure that we're giving the protein in appropriate packages, also in close proximity to that workout. So let's say someone's doing some strength training. I don't want to overload them with protein, but maybe we're thinking about a small protein-rich snack within an hour to 90 minutes of that workout.
Thank you. And talking about that strength training, Dr. Fielding, one of the questions in the chat was, what are some of the methods to build muscle mass and strengthen muscles? Are there any go-to strength training or aerobic activity exercises?
So yeah, let me just try to answer that as briefly as I can, Gage, and if I go on, just stop me. But the one important thing is our muscles really respond and adapt to the loading conditions that they experience. So if your muscles are performing high force, high power output activities, it's going to induce muscle growth, or what we call hypertrophy. Low force or inactivity, bed rest, zero gravity is going to cause you to lose muscle, and that's called atrophy. So if you go up into space for a year, you'll lose a tremendous amount of muscle mass. Even if you do those exercises on the treadmill and all the weight training in space, you're still going to lose muscle and you're going to lose bone. But for building muscle, the best exercises that we have are either strength or resistance training. And when we're talking about strength or resistance training activities, we can talk about a number of different things, including things like exercise bands, stationary weight machines that are in many gyms are useful. Any kind of handheld weights or dumbbells can be useful. Some calisthenic exercises like push-ups and sit-ups are strength or resistance training based. And then even activity that we perform in our homes, like digging, lifting, carrying, heavy housework, those also have some components of strength training. So, and those count too. It's not just what you do at the gym sometimes. And also some forms of yoga and Tai Chi. We're thinking about a minimum of 1 to 2 or even 3 sessions of strength training a week. Try to engage some of the large major muscle groups of both your upper and lower extremity, the arms and the legs. Doing something like 3 sets of an exercise, 8 to 10 repetitions. And we think about this term intensity of exercise, or how hard the exercise is. That's really usually synonymous with how much weight you're lifting. You remember Ronni mentioned that she started with low weights when she was just first training, and then she's progressed on to higher weights. Well, that's because her muscles are getting stronger. She's probably has had some muscle growth and hypertrophy. But we usually recommend an intensity of somewhere around, for optimal training, 70 to 90% of your maximum capacity. And that's usually the amount of weight that a person can lift about 8 to 10 times, or with 8 to 10 repetitions, so that by that 8th to 10th repetition, they really feel like they can't do another repetition. So that's kind of the intensity zone that you want to be training at. But lots of things can be included in resistance training. It's not just weightlifting. Calisthenics, things like yoga, heavy housework, they all count as well.
Great, thank you. And for Ronni, as somebody who has successfully done this strength training around 3 times a week, like Dr. Fielding was just talking about, do you have any strategies that you found helpful for remaining consistent with your strength training exercises?
I guess the most important part is to find a trainer that gets you and that you get them. Because if I had like a boot camp type of trainer, I never would have lasted. But shout out to Julia, who has been with me on this whole journey. She understood my hatred of exercise. She built slowly. It's a class of all women, which helps completely in the strength training world, because we're not competitive with each other. I have no idea what weights other people in the class are using. I just see them taking different weights off the bar and doing it. So she has us all going at our own pace. And also the people in the class have become friends. So another mental health benefit has been that I've made a whole new group of friends through these classes. Pick a time that you like, a time of day. She teaches classes at 6 o'clock at night. There's no way I could get to a class at 6 o'clock at night and be awake. 7 o'clock in the morning works well for me. So I stick with the 7 o'clock classes and I'm fine going. And when I don't go, I feel kind of bad. So something in my head has changed.
I need whatever that is in my own head. So for Jenna, question in the chat is, does menopause increase feelings of fatigue? And is there anything that can be done to mitigate that so individuals can have the energy needed to properly exercise?
Yeah, so one of the hormones that's very important for sleep is a hormone called progesterone. And so in the perimenopause transition and postmenopause, women do lose progesterone. And so one of the best things that I love to teach is that simply supplementing progesterone during that transition and postmenopause can really be helpful for a restful night's sleep. The more good quality sleep you get, the more energy you have to be able to do things like work out. And whenever I'm telling my clients, because we do manage both menopause and weight, whenever I'm giving them kind of the first initial task, as far as like what exercise to do, I usually tell them after you have a meal or a snack or whatever it is that you are doing to eat, you want to take a short walk. And I had one of my clients say, "Oh, you mean like a gas walk, like a walk to pass gas?" And that kind of stuck with me. So now I say, yes, you need a gas walk. So something, moving your muscles, we know it helps with like glucose management. And so if you can do that after a meal, that could be super helpful. And we do know that exercise is super important for sleep. So the more exercise you get, the better sleep you get, the more energy you have to be able to do that process all over again the next day.
Great, thank you. Maya, one other question that we had was, Do you know of resources that provide heart-healthy recipes that are also beneficial for muscle health?
Absolutely. So there are a number of resources that USDA has. My Plate has great resources. I will say when it comes to heart healthy patterns of eating, that sometimes we only think that we have to have steamed chicken, steamed broccoli, and brown rice. And I want to remind people that the globe is quite literally yours, and you can take from flavors all around the globe, and that there are wonderful plants, tons of delicious seafood and sea vegetables, ancient and whole grains that you can and should use when you're crafting that heart healthy pattern of eating.
That's so great. And then while we're talking about those foods that we're eating, is eating too much protein ever a concern? And what is the best way to know that someone is getting the right amount of protein and not too much or too little?
That's such a good question. So I would say in this country, there is the possibility that we can overeat protein. In, I'd say, developing nations or in places where there's like real food scarcity and shortages, that's not so much of a concern. But because so much of the standard American pattern of eating is centered around animal proteins, most of us are actually probably getting sufficient amounts of protein. My question, is it the type of protein that we want to see people getting? Meaning, is there variety? Is it the lean proteins? Are we getting seafood along with it? And I would love to hear what everyone else thinks, but for people, I would say, especially women going through the menopausal transition, I tend to think somewhere between 25 and 27 grams of protein per meal. That's what I tell folks with that look at variety. But again, if there are specific health concerns, there might be like a slight protein restriction. So this is where I would really say 0.8 to maybe 1.2 grams per gram of kilogram of body weight.
And then I guess we have time for one more question, and I can address this to everyone. Are there any specific lifestyle factors or habits apart from exercise and diet that can complement the benefits of physical activity and nutrition in reducing the risk of high blood pressure and sarcopenia?
I think I'll start by just reiterating the importance of sleep. Sleep can help with the way that we are able to manage our stress levels. Sorry, but wasn't able to get my toddler out of the room. And so that impacts everything from, again, how we manage our glucose to where we put on fat, how we maintain our muscle mass. So sleep is really foundational. And if you are a woman going through the perimenopause transition, definitely have a conversation with your provider about what hormone replacement therapy looks like and if you would be a good candidate, because we do recognize that replacing hormones can really help with everything from osteoporosis or bone loss to muscle mass loss to prevention of heart disease and better sleep.
So I couldn't agree more about sleep with what Jenna said. The other thing I just want to say, just two things, a little unrelated to the question, but one thing is, we've talked a lot about strength training exercise and a lot of very programmed types of exercise, and that's great. But just remember that any exercise is better than no exercise. So anything that we can get to encourage people to sit less and move a little bit more, as I think one of the other speakers said that, or something like that, is really important. So don't underestimate the positive effects of even small amounts of physical activity that you can be accumulating during your day. So even if you take a break from sitting or from your job and walk around for 3 or 4 or 5 minutes, or even a minute, 2 minutes, you can have sustained benefits to your overall health. The other thing I will say is, when we think about sarcopenia, hypertension, and we've talked a lot about blood sugar and, insulin resistance and diabetes risk, remember that as people get older, men and women, they don't just usually have one chronic condition. They have many times have multiple chronic conditions. So exercise and physical activity has important effects on preserving muscle, preserving bone health, reducing blood pressure, and has really tremendous impacts on reducing diabetes risk and risk of other chronic diseases. So just remember that exercise has these multiple effects on many chronic conditions. And that's why I think we think it's really so important and a very important lifestyle factor and something that we really encourage strongly.
I will say in the respective time, since we're over, that I agree with the other two presenters. And I would say in this process, give yourself grace and think about the small things that can be additive to your overall routine.
And I would say start today. It's not too late.
Great. Thank you. And just thank you all for sharing your expertise and your stories. This has been so great. And I want to thank you to everyone who is joining us and wanting to learn more about the connections between high blood pressure and sarcopenia. To learn more about sarcopenia and what you can do to prevent and address it for yourself and those you care for, please visit the Office on Women's Health website at womenshealth.gov/sarcopenia. Thank you all, and please have a great rest of your day.